Welcome to Olympian Water Testing, giving you the best in water analysis. Today we're looking at medical news today, and we want to identify the symptoms and the treatment when copper toxicity is too high. How can we know if copper toxicity is too high? And why is that important? Well, sometimes copper being in the water doesn't cause any problems. Unlike lead, there can be some levels of copper that's fine. But it can cause issues such as diarrhea, headaches, and in some severe cases, kidney failure. And if individuals have Wilson's disease, it can also lead to toxicity. So the biggest question is, how do we know that there's issues? Well, when it comes to copper in water, in 1991, the EPA published a regulation called the Lead and Copper Rule, which states public drinking water should not contain 1.3 milligrams of copper per liter of water. And some ways to prevent that from happening is running your tap water for more than 15 seconds after you turn it on. And it comes from copper pipes or brass faucets that can absorb copper particles, and particularly if these parts have corroded, and also farm and industrial waste can run off into the public. And it can be in food and air. But what are some ideas, or what are some indicators that it's too high? Well, it can reduce the liver's ability to remove excess copper, and it can cause issues in people of Wilson's disease, Menkes disease, hepatitis, or inflammation of the liver, Hodgkin lymphoma, leukemia, brain cancer, liver cancer, breast cancer, and diabetes. And some symptoms that you might be able to see present in almost every type of issue of the body with high concentrations of copper are bones, muscles, brain, liver, and kidneys. And it can lead to various symptoms, including stomach pain, nausea and vomiting, diarrhea, blue or green colored stools, dark or sticky stool containing blood, headaches, dizziness, fatigue, fever, chills, aching muscles, extreme thirst, tachycardia or abnormal fast heart rate, changes in taste that can lead to decreased appetite or anorexia. Also, copper toxicity can also trigger the following neurological and physiological symptoms, such as changes in mood, symptoms of depression or anxiety, feeling irritable or overexcited, and difficulty focusing. And if there's too much toxicity, it can also have severe health effects such as kidney failure, heart failure, loss of red blood cells, liver disease, brain damage, and ultimately death. Yes, it can kill you. Now, you have to have an excess amount for these things to happen, but it's always a good idea to make sure that you're monitoring and getting your water periodically tested so that you don't have any of these symptoms before this happens. Now, doctors can treat this toxicity in different ways, such as zinc, chelation, that helps bind copper particles in the bloodstream into a compound that the kidneys filter and excrete, then stomach pumping, medications, and hemodialysis as well. But we want to prevent it. How can you prevent it? Limiting exposure to copper from contaminated foods and drinks, avoiding the use of corroded, rusted copperware, cookware, dishes, and utensils, removing copper from tap water by running it for at least 15 seconds, and installing filters in the house to remove unwanted minerals from the sources. So, those are some good ways to prevent it, but another prevention is to make sure that you don't have it in the first place. And that's why it's always a good idea to get your water periodically tested and analyzed for copper so that you're sure that the levels are not too high and that it doesn't have any of these negative side effects.